I can't thank you all enough for coming today. And as I've mentioned to many of you, if I don't cry once today, it won't be a good program, so bear with me. My name is Sharon Jacob. I am a proud board member of Village HealthWorks for at least 10 years of my adult life. Village HealthWorks is a charity that is near and dear to my heart, and I hope you'll share that with me as we explain to you our mission. I'm going to start with, believe it or not, John Lennon passed away almost 21 years ago, not far from this park, and one of my all-time, I know it sounds a little crazy, or not, favorite songs is Imagine, and I thought maybe I'd start just playing it for you, because if you listen to the words, it makes you imagine a world where there's no hunger.
Imagine there's no heaven. It's easy if you try.
You can sing along too if you want.
No hell below us. Above us only sky. Imagine all the people living for today.
You may say, I'm a dreamer, but I'm not the only one. I hope someday you'll join us. I'm a terrible singer. And the world will live as one. Thank you for indulging me. So imagine that those words were written over 50 years ago by John Lennon and Yoko Ono, who often didn't get the credit. What a great way to start a fundraiser for Village HealthWorks, a small nonprofit located in the heart of a small African country called Burundi, whose mission is to be the center of healing and hope, focusing on healthcare, education, in a dignified environment while addressing the root causes of illness, poverty, violence, and neglect. Imagine. Over the past 10 years, I've traveled to Burundi almost 15 times, if I'm keeping count, with many friends and a lot of my family. And I personally invite each and every one of you to join me on our next trip. I promise that your life, as you know it, will forever be changed and impacted by what you see in this faraway place in one of the poorest countries on the planet. On a recent visit, we had the opportunity to go to one of the villages and visit a local community members, many with sick children, torn clothing, no shoes, little food, no running water, the most extreme poverty that you could ever imagine. Imagine if you were a parent or that child not being able to provide food, clean water, or medicine if your family member was sick. I will never forget one of the mothers boldly and bravely asking me, why in the world was I even there? And after I fought back tears, which I wear my heart on my sleeve, clearing my throat and through an interpreter, I managed to say, there are many people in this world that are trying to help, that are working very hard to build the hospital, to bring education, here we go, to their communities and to help them to learn how to grow healthy food and learn more about clean water practices. Can you imagine? I told this community meeting members that there are many friends from far away that think about them all the time keep them in their hearts, and hope to find a way to help them. And many of you are in this room today to help them. Can you imagine? It's not hard to imagine what could be if, in fact, a teaching hospital was finally completed after 10 years, and how it could transform a country. It wouldn't be hard to imagine the impact of having a hospital that could provide pregnant mothers in need of life-saving cesarean sections, and the impact it would have on an entire family that would be left behind if she didn't survive. It couldn't be hard to imagine what could be if, in fact, the young people of this country could be educated to provide a foundation of learning. I could go on providing, imagining situations and images to all of you, and I could go on to say that you may say, I'm the dreamer, but I have to thank each and every one of you for being in this room to dream with me. It's with that hope. I encourage you to dream of a better world, to enjoy this lunch, no matter what has come, and no matter how many people are sick today. Please continue to support this work being done in this village far, far away from each and every one of us today. For so many people, the reality of where they were born are why they've been given the challenges they have to face. Stop it. So, we have an incredible video to watch about the work being done at Village HealthWorks, with a brief discussion with Deo, Rishi, and my husband Bill is filling in for Allie Wentworth, who unfortunately has the flu. Thank you so much for coming, for caring about Village HealthWorks. And I would like to remember and thank today and dedicate this luncheon not only to dear Dr. Paul Farmer, but my mom and my parents, who taught us very early, even with limited resources, and how important it was to give back with all your heart, and that has made a difference in my life. Can you imagine? Thank you.
Village HealthWorks started in Burundi in 2006 when I started mobilizing community members. And I started mobilizing community members after visiting a number of hospitals in Burundi. Burundi was coming out of this horrible war that lasted 13 years. I knew that the country had been suffering, but the magnitude of suffering of patients in hospitals where there were hardly any doctors with medications, where people were going to watch themselves die. I looked into everyone's faces and wondered, how can anyone really find happiness again and hope in this absolute hell on earth? Village HealthWorks was created to be a center for healing and hope for community members who need that hope the most. The mission was exactly to create a space, a dignified environment where those who need our care could go to and be treated like human beings like everywhere else. When we started, we opened our little clinic in Kigutu. We really wanted to just help patients. But as we are seeing patients and doing home visit, we saw that we could not just give medications to patients and hope that this place would change. That's how we integrated many programs such as agriculture, nutrition, education, economic development programs, and music and the arts.
Village HealthWorks is trying to break the cycle of poverty. You can't break the cycle of poverty just by having good health care.
What we have with Village HealthWorks is a translatable model to end extreme multi-generational poverty and empower communities that have fully lost hope, and to do it in a way that is self-sustaining.
Health is not just treating disease, but it's actually working toward a betterment of human life. And That is what Village HealthWorks does every day through delivering healthcare, supporting communities, working with farmers, helping children learn. It's really a hopeful environment. That's what Village HealthWorks is.
We created the boarding school, Kigutu International Academy, to give the students a chance of having an education based on critical thinking, to give them a space where they can explore with their teachers where their talents, hidden talents are.
We center our education not solely on the academics, but also on the values that are translated into reality in everything we do. The 5 values are excellence, resilience, ethics, compassion, and service. The goal or the vision of the school is having caring thinkers, producing problem solvers, especially creative problem solvers, in a nation which has gone through a lot of tragedies.
I learned that I really like to take on leadership positions. I would like to be a philanthropist, which means I would really love to bring something that could help people, but I would also like to become a certified public accountant as well as an entrepreneur.
Being a student here helped me see myself as a future change maker of this country and bring some innovation in Burundi.
Those were some incredible kids at KIA. All of them were entrepreneurial, all of them had really cool ideas.
There was one student who on his own had created this mock-up of a car wash, complete with the spinning pillars and the flaps of cloth. It was incredible.
He's got a business plan to create a chain of car washes in Burundi.
So it's really that kind of vision, give opportunities to these young minds to learn, to have access to information, and to become the future leaders that the country and the continent and the world really desperately need.
I had never been to Africa before this past summer. One of the most striking things about that visit was the campus felt like a vision of what all of Burundi could be like.
Coming to camp is like entering botanical gardens. There's flowers everywhere. It's laid out like a park. It's beautiful.
The most important thing I saw when I visited Kigutu was the near completion of the Kigutu Hospital.
The Kigutu Hospital, the Women's Health Pavilion, is planned and designed to be 170-bed hospital. It's the first hospital of its kind to be really situated in a rural setting. It means that people in Burundi and the neighboring countries within East Africa will be able to easily access and get treatment that is also not only high quality but highly affordable.
Building a beautiful hospital in a place like Kigutu will shake up the paradigm. It gives the doctors, the nurses, others the sense that you're working in a beautiful, dignified place, and it makes the standard, which is really bad, like obviously really bad.
And those very oppressed, marginalized people who for so long have been treated like subhumans have a place they call their own in their own communities, on their own land.
The hospital is actually going to play a major role in teaching and training healthcare workers. Our dream is that eventually we will contribute greatly to the whole sub-Saharan African Burundi having better trained and qualified personnel.
Train these people right there where they are and get the flow of knowledge everywhere where it's needed so that you keep them and they are serving people.
The opening of the hospital is going to create a momentum in and of itself.
Having a hub for a network of services, of learning, of, basic jobs and training. This is like a very, very important aspect of having a teaching hospital.
Not only are there going to be doctors and nurses there, we're also going to have technicians. We're going to need service industries in order to support them all.
People will come for conferences to learn the services, whether it's X-ray or lab, can be utilized for a region.
This is the proverbial rising water is going to lift everyone's boat. This is going to lift everyone's boat.
Continuing to support Village HealthWorks is extremely important because it solves problems not just in Burundi, but it solves problems really globally. in a way that it really inspires others to see what is possible.
When we say equity, which has become a word that everybody's talking about equity, it means something. It means do the things you need to do, invest in the things you need to invest in to improve people's lives, particularly people who have been historically left out.
We have moral obligations to help the people of this region lift themselves out of poverty.
I've likened the organization in its current state as like a 16-year-old prodigy that you can see what she'll accomplish if she's given the opportunity to finish her training. But she needs a scholarship to go to college, and then she will change the world.
With all this progress we have made, nothing would have been happening without supporters of Village Healthworks. They really took on this organization, and the community kind of adopted it like their own family. So I cannot have the right word to describe the gratitude I have in my heart for them.
mpagaze nshima nserukiye abakenyezi ukuntu babitaho mu kubafasha mu gihe cyo kwibaruka bakibaruka neza bitagoranye.
Turashimiye ikigo cy'Ikigutu ku nyigisho batwigishije kugira turamye twasubira kugira amagara meza.
I have already figured out what I want to do and what I want to become, and that has all been made true thanks to Kikutu International Academy and mostly Village Healthworks.
This is an excellent school for future leaders and future change makers, so thank you for this school.
Iteka ntangere ku bantu b'Ikigutu kuba turonse ibitaro bimeze uko kuntu bazobagiramwo abavyeyi abafise ingwara zitandukanye.
Thank you Village Healthworks for working to bring dignified and compassionate health care to the people of Burundi.
I have some good news. Good and bad news. Dear Allie Wentworth is sick in bed with the flu. So I had her little bio all prepared, but I think I'll speak from my heart when I say the good news is my husband, Bill Jacob, has taken over the responsibility of hosting and discussing the discussion today. He's been a proud board member probably as long as I've been. He is generous and kind and absolutely the best person to go through life with I could ever imagine. So I am so lucky to have him step into this role. I'd like to also take this opportunity to introduce Deo Gracias Nizonkiza, who's my other sweet heartfelt brother in arms. He always calls me his much older sister, which I think might have been lost in translation. I said, well, anyway, that's another Oprah. So, for all of you that might not know Deo's story, I would highly suggest reading the book, The Strength in What Remains. Tracy Kidder wrote it, Pulitzer Prize winning author. It's a book about the journey of remembrance and forgiveness. Goodness knows we are so blessed to have him join us in this country from Burundi in search of a new life after surviving the civil war and genocide. Homelessness in this gorgeous park. In fact, he actually offered someday to take me to where he slept at night, if you can imagine that. He later learned English and found his forever home with Nancy and Charlie Wolf, our dear friends, who was a middle-aged couple who had no children of their own. He was introduced to the kindness of strangers who would forever change the course of his life and many others. He entered Columbia University, Harvard School of Public Health, and eventually wound up at Dartmouth. Imagine that. He ended up at Dartmouth, Harvard, and Columbia without speaking English when he arrived at JFK with $200 in his pocket. So he's the founder and the CEO of Village Healthworks, and I couldn't be prouder to call him a friend. Unfortunately, Joya, Dr. Joya Mukherjee, coming from Boston, was stuck on the Acela. So no matter what, the convolutions of life's and its trajectory has enabled her to be here tonight, or today. So we're gonna ask our board chair, Rishi Narang, to actually step into this conversation and talk about and discuss. And Rishi, I have your bio, but maybe you can speak about your background and why you find Village Healthworks so important to you. So without further ado, I'd like to ask Bill, Deo, and Rishi to join us here on stage.
Okay, gentlemen, welcome. And honey, lovely intro, and Rishi and Deo and I are going to try and figure out how to do our McCartney, Ringo Starr, whatever, tie in with the John Lennon. So you two gentlemen, what do you think in your minds as you look at Village Healthworks? What sets it apart? As the folks out here look at different charitable organizations and opportunities to invest their time or resources, what makes Village Healthworks unique? What sets it apart?
It's unique because of all the organizations I have been part of, whether it's public or private, I have not seen anything that is community driven. In a country where almost everyone was afraid of everyone because of the horror of the war. So when I went there, after years, I went there because I believed that these Hutus and Tutsis were not created by God to kill each other. It was simply the living conditions that were dehumanizing that created these problems. And so instead of dealing with the consequences of these man-made tragedies or natural disasters, let's actually deal with root cause of the problems. So I moved to Burundi to see my mother, and then I saw patients who were detained in hospitals because they could not pay for substandard care. They were Hutus, they were Tutsis, they were women and the children, and they became friends. So my question to them was, why can't we become friends outside and do something to reclaim our decency? So those are people, yes, you hear about Burundi is the poorest of all. There's no shortage of wars, but there are more opportunities than wars. If people are given just a tiny opportunity to do something good, you will see that they are actually more capable of being constructive than being self-destructive. And so that's why I love it. Village Healthworks came from less than nothing, but extremely lucky to have friends like you. Everyone really I call here a family member, to actually buy in and go in a place where that has been avoided by so many, and they didn't take anything, even just shaking hands, for granted, because they were not used to that. Right. So that's what I can tell you the success of Village Healthworks.
Rishi, building on some comments you had in the video, you talked of Village Healthworks, the 16-year-old prodigy, and the ability to have a sustainable model. Can you just elaborate for the group a little bit on those two comments?
Yeah, so I went to Africa for the first time in my life this summer and spent my time in Burundi, most of it in Kikutu. And it's unbelievable what's there. It is stunningly beautiful, opulent, but all with nature and kindness and dignity. So yeah, it's a prodigy. This thing has erupted from the community that is so important, and it's a shining light on a hill for the rest of the world to see. A fully translatable model that literally will change the world. I mean, I don't know how else to say it, but to step back a bit, one of the things that really sets the place apart, modern times it's very easy for us to take easy, quick answers. But the problem with poverty, like extreme multi-generational poverty, is that this is not an easy, quick fix. You're not going to get a good result unless you address all of the causes of poverty. And it takes a lot of effort, like an absolutely Herculean amount of effort on the part of not just the founder and the team, but also the community to be willing to fight all of those fights. This is a many-headed dragon. And that, to me, is really the most unique thing, is it's this community-led effort that is many-headed, it's many-pronged, because it has to be. There's no alternative.
Deo, what do you feel is some of the most proud, the elements of Village Healthworks that you're most proud of, that you could share with us today? When you have a chance to reflect, like, wow, when I was dreaming 17 years ago, I never would have believed this. What makes you proud?
I don't look back easily. I keep looking forward. What I am mostly really proud of is to work in that community feeling so safe, and that safety is a result of this community mobilization to do good, to community strengthening, to work together. And the result of their work in peace, reconciliation, has really made Village Healthworks what it is today. We have truly built a global, not just a local community, like I call my own family.
Yeah, no, keep it up, brother. A question for each of you. And Dale, building on your, I look forward, right? What, as you look forward, are one or two current challenges in front of you that you could articulate for the group that maybe they could help you with as you look to steer Village Healthworks, you know, higher and higher?
I mean, funding, it's a trivial answer in a certain sense, but it couldn't be more obviously true. So our budget this past year was 10 million, which, considering the amount of work we're doing, is a shockingly low number. It could easily today be 15 million and like kind of meet the need. Funding would solve 1 billion problems, actually. So, yeah, like that's by far and away the biggest challenge.
You know, for me, I look at these challenges in so many different ways. It is, I have many personally. One is feeling really being stuck in between worlds. I know what $1 does in Burundi versus what does here. Our beloved poor farmer who just passed away unexpectedly, we were talking the other day. We had a plan to go to Burundi in April. Unfortunately, he didn't make it. And we're talking about this hospital that we have been building. So, Dale, how much have everyone, friend, and you raised to build this 170 plus teaching hospital, 20 million plus? So he's really thinking about all this. Then he gave me an example of Children's Hospital at Stanford, 3-point-something billion US dollars. And this is what it costs over there, and this is what it costs in Burundi, and this is how, you start talking about, are some humans less humans than others? Why does it have to be too expensive in Burundi, building something that would cost billions of US dollars in the United States, seeing, human beings? So that is really a challenge. At some point, it makes me feel like this is how too much is too much, and what the cost of a human life. If we don't do anything, it costs much more. And I think it's been really hard for me. I don't think, to talk about a Burundi that has been off the map, a country I love so much, and yet a country that gave me so much agony. Those who may not know, I show some friends. This rock you see here, that was my mattress back in 1994. I showered in this pond right here. I don't know what you call it. I was kicked out at a wedding ceremony. And so without a global community of people who are compassionate, who understand what the meaning of life, just one life, means, I wouldn't be sitting here. So despite of these challenges, I have so much hope. I really consider myself as an eternal optimist. And I'm so grateful to each one of you for being here, because you do understand and you do care just listening to this story. Thank you.
Deo or Rishi, could you share with the audience just a quick update on the hospital, where we are relative to, fully on, how you're recruiting folks in, how you're taking that dream and actually making it reality in 2023?
We are now busy reaching out to friends and friends reaching out to friends to make sure that this hospital that is finally being completed, to get the right healthcare providers, physicians, nurses, midwives, you name it, from places that have been extremely lucky to have the knowledge that has been lacking in Burundi. So we are really building this community of skilled people and the kind people to go there, not only to see patients, but to train.
Construction is done. I've walked through the building. It's ready to go. The equipment's being installed, and it needs to be staffed, and there's the last little bit of funding to kind of get it over the hump. We're thinking a soft opening first quarter.
Correct.
So.
Stay up there. No, Rishi, stay up there.
Get up there.
Stay. We'll bring another chair.
No,
No, it's good.
I've said what I need to say.
Oh, okay. All right then. Hi. Hi, my dear. Hi.
Go.
Okay. What a beautiful spot. Thank you for having me. Sorry I'm so late. My friend, helping you.
The drawbridge eventually went
Yeah,
back
it went
down.
down.
The train made it.
Yeah, there was a drawbridge that was stuck for 2.5 hours. So much for infrastructure in this country. But continue. I don't want to interrupt. Wait, I would like to go ahead and read your bio. Okay. So let me explain. Joya is the Chief Medical Officer for Partners in Health. She has been a board member. Well, she's been at Partners in Health for 25 years. This is a doctor who has been a board member of Village HealthWorks since the inception of our organization. She's not only an internist, a pediatrician, public health and infectious disease specialist. She's an author, a human rights activist, and an associate professor at Harvard Medical School. This woman has traveled all morning to be here and has put up with the Acela and a bridge not operating. So I have to give my due respects and thank you so much for persevering, because I would have gotten off the train and gone home. They would have let us. Well, Joy has worked in Haiti, Rwanda, Malawi, Sierra Leone, Liberia, Peru, Mexico, Russia, Kazakhstan. She's joined Paul Farmer at the inception of Village HealthWorks and just visited this last summer. So her experience and expertise in infectious diseases, health systems, and social justice is why these are many reasons we are so delighted in welcoming you to this luncheon today and conversation. And this is Bill, my husband. Okay. That one I know.
The most important part of the bio, Sharon didn't mention, Joya was my boss.
Yes, Deo
my
was
first real job.
Yeah, true.
So maybe Joya, maybe just share with the group, what draws you to Village Healthworks? What do you see that's inspiring that you could share with folks and maybe get talking like that?
Awesome. So, look, I love Village Healthworks, and what draws me to Village Healthworks is the same thing that draws many of you, is of course Deo, Catherine, the amazing people in Kigutu, the people in the community. That's who we're here for. And as frustrated as I was with the Acela today, I thought, this is nothing compared to what women in the village experience every time they have to get water, or their children are sick, or they're pregnant. So, our struggles are so tiny compared to what we see in a place like Kigutu. But, what I think brought Deo and I together so many years ago when we first met, I think in 2002 or something, was that there is a total lack of dignity and humanity in our world, and it's getting worse because of COVID, and I think we've all experienced and seen it in the newspapers and, on in the web, et cetera, newspapers. I still read newspapers, actually in print. And really what it is that when Deo was in school many years ago, when I started my work in Africa, which was more than 30 years ago, there was no medical care for people on the continent, period. No medical care. There was prevention. You could do vaccines, you could give vitamin A to prevent blindness, you could maybe teach moms how to make like this oral rehydration like Pedialyte. But if somebody had a broken leg, there was nothing you could do. If a woman was in extremis during pregnancy and needed to have a cesarean section or blood, there was nothing you could do. And that has created a disparity of nearly 30 years in life expectancy between people in Burundi and people right here in Manhattan. And the reason that is because we don't care enough, because we don't invest in health as a basic human right. How many women in this room have had a cesarean section, right? So many of you, right? All of you would have died. And your kid would have died, right? Most of the time when we do a C-section in a place like Burundi, it's to save the life of the mother. The baby is often already dead. This is unconscionable in the 21st century. And I think what drives us is this basic idea of human dignity and also women's rights, because women bear the brunt of so much of the ill health and suffering. So it's really this idea that we all deserve these rights, these basic human rights. I think we have a moral responsibility for the people we care about in Kigutu, but also we have a moral responsibility to show the world that in the 21st century, we can do better. So I'll stop there, but I have plenty more to say, as always. And I have laryngitis, which for me is like a death sentence, but it's getting better.
Thank you, Joya, for getting here. My heart was racing, and I knew that we could make it happen, and Rishi did a great job, but we are so pleased to have you. Behind Deo's shoulder is a small print of the mural done by Franny Kidder, Tracy Kidder's wife, for the Kigutu Hospital and Women's Pavilion. It's two pregnant women looking at each other with a bunch of kids in front of them. If you look at the hospital at some point, it's two pregnant women looking at each other. It's two wings of a hospital. So this mural is going to be in the hospital and done by local artists. But I have one for each Joya and Deo to take home today. That makes it worth a trip from Boston. So it's one of a kind, so to speak, and it's a print of that. And I'm also going to actually, if I can, recognize Sharon McKenna. So I'm moving right along here. Sharon McKenna answered that door at the rectory of St. Thomas More. She actually met Deo as he was delivering groceries from Gristrides right on Lexington Avenue, if anybody knows the Upper East Side. It was Sharon McKenna who actually has continually given of her savings to Village Healthworks in support of the original healthcare center and to the Kugutu International Academy, in which 2 buildings on campus are named after her. It was Sharon McKenna who helped find Deo his adoptive family, Charlie and Nancy. It was always Sharon McKenna whose kindness made all the difference in the world, and to Village Healthworks and to our family as well. We can't thank Sharon enough. And from the bottom of our hearts, I wanted to present her with one of those murals that was painted by Franny Kidder. And I wanted to ask her if she wouldn't mind, and was able to come up. Sharon McKenna.
Let's see. I'm just so very grateful to Deo and Partners in Health, Joya, and many others. When I left the monastery, I really wanted to be in a situation where more money could be given to the poor. I loved the monastery, it was beautiful, but I didn't need more room to bow and new buildings there. So I was hunting for somewhere to put my little pennies. And I mean, who fell into my lap but Deo? And it was just a simple response to someone in need. I love Paul Farmer's words that charity is very good, but what we really need is pragmatic solidarity with those who are suffering. There's so much that could be done here in America, but all over the world, if we had a sense that we really are one human family and that no one should be put aside. There's a Rabbi, Michael Lerner, who recently wrote a book. Well, what we need is, the title of the book is Revolutionary Love. And how can we first discover that in our own lives? And then it's not some grim responsibility we have with a frown, yeah, I should do this, I should do that. But it's a deep conviction that this is a very joyful thing to be involved in. We can do it. We have what's necessary if we can encourage one another not to give up. So thank you.
Right. There's just nothing like the kindness, the compassion, the support, and the generosity that is in this room and that can be shared. And I can't thank you, honestly, from the bottom of my heart. If you really feel compelled, we need every last penny of contributions to sustain the work that's being done in Kugutu, and we can't thank you enough. And we'll see you next year, hopefully here at the Boathouse. So thank you for coming.